Are you wondering how speech therapy will help your toddler? As a person who benefited from speech therapy themselves and who also just went through the process of having their child in speech therapy, I'm going to be sharing with you my experiences, some of the signs that you should be looking out for, and if it really does help with your child's speech delay. Now, before we begin this video, I just want to let you know that because everything varies from state to state, county, and city, all of this information is based on my personal experience. It's going to be very general, but you will be able to find a lot of this very, very useful, especially regarding the results and if it's something that you should look into for your child. Now, let's back up a little bit. If you have no idea what I'm talking about, speech delay is how you will lead to speech therapy. So a speech delay in toddlers is anything of a cognitive or motor delay that your pediatrician or even you notice in your child. So this can be delays in speech, it can be delays in feeding, it can be also delays in fine motor skills that they should be developing once they get closer to 12 months. So a toddler is anyone over the age of 12 months up until the age of 3. Sometimes they do classify toddlers up until the age of 5, which they're technically preschoolers, but all this information is usually beneficial for children under the age of 5. So if you have a child who's under 5, this will be relative for you as well. Now let's talk about some of the causes of speech delays. While it's not really tied to anything specific, if your child falls into one of these categories, they have a higher propensity of having a speech delay. All the resources that I'm referencing will be linked in the description box below so that you can take a deeper dive into it as well. But these are just things that I've experienced as well as my son experienced. And if your child has a speech delay, they're probably experiencing these things as well. Just so that you are aware, 1 in 5 children will have some type of developmental delay, whether it's speech or a physical delay or disability. So it's not uncommon that your child, as they're growing up, will have some sign of being delayed in some area one way or another. There are also family factors that go into a speech delay. So for example, I had a speech delay, so it might lead to your child having a speech delay. Both myself and my son were firstborn children. So you can kind of look at that pattern and say, okay, well, if I'm a firstborn child, my son's a firstborn child, we both had speech delays. So you can make a correlation in some aspect about that. It's not proven, but that's just an example of family factors and how your child might have a delay. If there's another person in your family that might have a delay, a lot of times it is linked to family factors for your child having a speech delay. Depending on how your child was delivered at birth, if you had a difficult delivery, maybe you were stressed during birth, maybe there was some type of trauma to your child while you were delivering them, that can also lead to factors of there being a delay, as well as your child having lip or tongue-tie difficulties. If you find that your child, like my child, had to have lip and tongue-tie surgery, if you find that your child has having issues with eating, swallowing, using motor and developing oratorial skills, that could be a sign that they may have a speech delay or difficulties as they get older. So for me, one of the things that I noticed with my child is that the speech delay really didn't come with communication. It came with how information was being processed. One of the things that speech therapy will do is help your child figure out ways to have them communicate that is very effective for them. For me, I was completely nonverbal up until I was about 4 years old. My son has always been verbal, so that's just an example too of the differences between different levels of delays in your children. You will also find that having your child participate in speech delay will allow them to be better in social situations. It's not okay to let Tommy and Jill be 5 years old and not be able to ask for a glass of water. I know that's how they did it back in the day, but we definitely have resources now for them. And if you notice that your child is not able to ask for water, say bless you, say mommy and daddy, you need to figure out what those situations, like why that is, so that you can get them the help that you need. Now, every single state state, as I've mentioned, has resources for your child. So I'm going to show you an example here, how you would find that information depending on what state you live in and where to look at on the website. It will vary based on your county or where you live, but there are state level resources for your child. And depending on how old they are, they will either be able to stay in until they turn 3 or until they test out. I will say that all children have to test into speech therapy. So this is another great way that speech therapy is beneficial for them, because you have someone, for example, if you're going at the state level, come to your home and evaluate them that way. They'll be able to see them in their natural environment, how they're able to communicate. Of course, there's different levels. Sometimes they will also recommend having occupational therapy, which just means that as they're trying to communicate, they notice that when it comes to using fine motor skills, they're not able to use that to help with their level of communication. So for example, a 12-month-old should be able to say dada and maybe try to pick up an item. But if you notice that they're struggling even to try to pick up a piece of paper, then they would also recommend having occupational therapy along with speech therapy as well. Usually the speech therapist will let you know if there's any additional therapies needed at that time. If it's more of autism, additional testing that will be needed, but it all starts with having that initial evaluation for speech therapy, and then from there they'll let you know if it needs to be escalated for the autism spectrum or even on the occupational spectrum. Another reason why it's beneficial is because they will get individualized treatment, and as they get older, if they need to continue speech therapy, they will be around people in their same age group having similar treatment. I know sometimes it can be daunting as your child's getting older, they're going into pre-K3, pre-K4, and you're having them in the general population and you're nervous that they're not going to be able to communicate effectively with other children. If they are in a state or county run program, they will put them with peers who are going through the same things as them. So at least up until the first grade, you can still kind of protect them from being in any type of situation that will allow them to feel uncomfortable with communication. If your child is also going to daycare, your speech therapist, depending on where you live, could actually go to the daycare or the school facility that you have your child and have them go there and perform the treatment around other children as well. You will really feel supported. You'll get a caseworker. So it's really beneficial to look to see if your child will need speech therapy. Now, as a millennial, I tested into speech therapy when I was 2 and tested out when I was 6. So I was in there for about 4 years working on developing my oratorial as well as cognitive development. So these are definitely things that will benefit your child, signing them up for speech therapy should you have any concerns with it. Now, depending on your child's age will determine what type of speech therapy they are going to be participating in. A 1-year-old is not going to be able to participate in flag football. So there are different types of speech therapy. The most common for children up until they're about 3 is play speech therapy. So the therapist is going to be using techniques to interact with them and build vocabulary and cognitive language through play. I will list in the description box below some great toys to use at home to kind of assist with your speech therapist in getting your child to build up those vocabulary muscles, but they will be doing more interactive play. So things like block. If you're more in the Montessori realm of it, you'll get like a sensory bin, and they'll have your child point out like how a rock feels or sand, and naming it individually like that to kind of build one on top of the other. It's not whereas you're reading a book, for example, for someone who's much older. Now my child is 3, so all of the speech therapy that he has participated in currently has been play-based. But I did want to let you know that it's the most common, that it will be centered around toys, and that your speech therapist will recommend specific type of toys that you get for your child's needs. As mentioned, I will list a few that we have used below that have been really, really helpful. And as he's gotten older, he absolutely loves to play with them as well. well now. The other common type of speech therapy that you might encounter is family-centered. So the state, or if you go to a third-party center, they might offer this. This is pretty much where there were a few sessions where I would sit in the room while the speech therapist was interacting with my son, and it became more of a family-centered therapy where I could see firsthand what he's doing, what he's not doing, provide feedback to the therapist and vice versa, so that we can really get a good game plan together on how we're going to increase his speech as he gets older. Those are the two common ones. There are other type of speech therapies, but usually for small children, play is going to be the best kind. They will have family-centered. If that's something you're interested in, make sure to let your speech therapist know. Most, if not all, speech therapists will be very accommodating to that. If you want to be in the sessions, that is something that can definitely happen. So you don't have to worry about it's just your child and the speech therapist. You can definitely be involved in that as well. Along with the different types of speech therapy, there are exercises that your speech therapist is gonna have your child do. And trust me, it's not gonna be easy for you and it's not gonna be easy for them, but they are necessary to ensure that every couple of months they're hitting different milestones and you're seeing an increase in oratorial skills from them as they're going through the program. One of the first things that you'll notice is that they're playing games. As I mentioned, for younger children, the therapy is going to be play-based, and there are going to be games that your speech therapist will do with your child to try and get them to remember words, sound words out. So it can be as simple as playing a little goldfish game and then asking them to sing the letters of the alphabet. If they get stuck, they would skip over it. If your speech therapist is also combining occupational therapy, you can use the fishing game to kind of have your child pull out the letter and then have them sound it out and make that word. So that's an example of the game type of speech therapy that your child might be participating in with your speech therapist. Your speech therapist is also going to have them doing some level of arts and crafts, so putting together maybe a snowman for the holidays if it's around Christmas or Easter. Daycares do this as well, but your speech therapist, if your child seems to react better to doing arts and crafts, will also allow them to participate in arts and crafts. So picking up a cotton ball, putting it on a piece of paper, using different type of plastic sticks, straws to create different type of animals and different kind of shapes to help build vocabulary as well. You will also notice that they're asking you to do vocal exercises. So usually the speech therapist, depending on your child's age, will let you know things that you need to repeat to them, things that you need to work on. For example, let's say your child has a difficulty with answering questions. So one of the vocal exercises you would do with them is giving them an either or. So you would say, do you want the cup or do you want the plate? And that will challenge them to vocalize what they want. And the more you're doing these vocal exercises, allow them to feel more confident in responding, but also build up that muscle of speaking. So those are just some of the examples, common examples that you will be doing, the exercises for speech therapy that your speech therapist will be working with them in session as well as in home. Please note that everything that they're doing in speech therapy will have to be followed up at home. So if the speech therapist is giving you specific instructions on things that you have to do with them, you will have to follow up and do it at home. And the speech therapist, if they're really good, will be able to tell if you're following up on those exercises or if you're just not doing anything with them, because they will be meeting with your child on a regular cadence. And if they don't see any improvement, and based on the conversation that you're having with them, they'll be able to tell if you're like really helping to move the needle or if you're not doing anything. Now that's for more of a third party outsourced speech therapist, but if you are having services with the state, obviously the state will let you know how your child is doing, and they have different milestones when they'll be testing your child can continue in the program or not. So you'll have more of a regular update of how your child is doing in the program, I would say every 6 to 12 months. If you were to ask me if speech therapy was effective, I would say absolutely. Just in a year and a half that my son has been in speech therapy, he's saying saying full sentences, and he is a lot more confident when answering questions. No, for 3, he is not where a 3-year-old should be, but he is definitely a lot closer than he would be had we not invested in getting him speech therapy. Now, we use state level speech therapy, and we also use a private practice speech therapist as well to kind of work in tandem for the days that we knew he would need extra speech therapy. That is also a decision that you and your family can make. Just because your child can test into early intervention or early childhood program for your state, that does not mean you have to go through with that program with that state. You can go with a private practice, or you can use a combination of both like we did. As a person who had speech therapy from the state level for 4 years, I can just tell you in general, it has helped me, obviously. And so I would highly recommend anybody who sees the signs that their child might be struggling with communication to get that looked into. All of the tests to test into these, either private or the state level, are free. So you don't have to worry about at the state level, are they going to charge me to test my child? The answer is no. It should be free. Now, as far as you coming into the program and then having to pay for services, that depends. But as far as your child initially getting tested, that should be free. As mentioned before, I'm going to leave everything in the description box below for all the references to what I mentioned in the video so that you're able to take a look for it for yourself. I also mentioned that because things vary by state, one state does one thing, one state does another. You'll just have to see what your state is going to do, but the toys will be linked. I also have written some blog posts about my personal experiences with speech delays for my child and my experience as well. If you want to take a deeper dive into that, I will link the blog post in the description box below for you, as well as the toys. If you want to just hear my personal review on a speech development toy that I highly recommend, that is a 2-player game for you and your child, I'm going to link the video right here so that you can watch that now. I also have a full playlist for child development milestones that you should definitely look into, all for toddlers. So my son just turned 3, so everything in that playlist will be applicable for you and your children. See you next time. Bye.